So today's topic is lymphoma. Lymphoma is nothing but malignancy of lymphoid tissue or lymph node, whatever you may call. In many occasions, in many conditions, there is benign enlargement of the lymph nodes, such as any infection, any viral infection, fungal infection, tuberculosis. Those are benign enlargement of lymph node. So whenever you go to clinic and palpate lymph node in different anatomical group, such as cervical, axillary, inguinal, etc., instantly you must have the clinical conception that what you are dealing with, is it a benign one or is it a malignant one? If it is benign one, there is no problem, excepting that in our country we suffer from tuberculosis very often. So apart from that, when the lymph nodes are very enlarged in groups and firm to hard, you can, if you palpate properly, if you know the palpation, you know, firm to hard, you must have something in mind. What is there in mind? Lymphoma. In my class of leukemia, I have already mentioned that we utter leukemia, lymphoma in the same breath. Suppose there is leukemia of lymphocyte, such as acute leukemia. There may be lymph node enlargement, or chronic lymphocytic leukemia. There may be lymph node enlargement. This is a part in the blood. If we come to the lymph node, they are very similar. If we come to the lymph node, we will call it lymphoma. So it is oma, the term is tumor, but here lymphoma means malignancy. Melanoma, it is not benign. It means malignancy of nevus cell. So there are two types of lymphoma. So what is the basic thing in lymphoma? There are two types. One is Hodgkin, by the name of the discoverer Hodgkin, and one is non-Hodgkin. Why they are different? Because of their clinical presentation. Clinical presentation, prognosis, origin. They are different. Hodgkin lymphoma, they originate from, now we know, in our time we didn't know where from Hodgkin lymphoma arises. Now we know for certain that it arises from B cell. So what is the basic difference? Difference in origin, difference in clinical course, difference in presentation, etc., etc. Both are malignancy of the lymph node. Hodgkin's arises from B lymphocytes, and non-Hodgkin arises from all immunologically active cell, B cell, T cell, immunoblast, NK cells, that means natural killer cell, everything. So this is the thing. So you have to know, especially if you in your future life, if you go to oncology, if you go to hematology, you have to know, and you have to read it again in probably in medicine, surgery, etc. So basic, the knowledge of lymphoma is very important, and for you undergraduate, Hodgkin lymphoma is very important. You can note it down. Huh? Hodgkin lymphoma is for undergraduate students. Very important. Non-Hodgkin is not so important for you. So, this is the basic thing. Another thing, you must be reading MCQs. One virus is related to Hodgkin lymphoma. What is that? Epstein-Barr virus. So, in certain percentage of Hodgkin lymphoma, this virus is associated. This virus is very important for medical personnel, and it is very important in MCQ. Almost all MCQs they contain Epstein-Barr virus because that virus causes different clinical conditions also apart from Hodgkin's lymphoma, right? Got my point? So, Hodgkin lymphoma, it arises from B cell. Some of the Hodgkin lymphoma are associated with Epstein-Barr virus infection, and that B cell is typically crippled B cell, not ordinary B cell. In non-Hodgkin lymphoma also they arise from B cell. That B cell has got normal antigenic character. You remember this point. In Hodgkin's, that B cell is crippled. It doesn't show its antigenicity. This is the basic difference. So now we can go through the PPTs very rapidly. You can raise your hand. Raise your hand if you don't understand. Without understanding, attending a class or reading something is just fruitless. Everybody knows, everybody sitting here knows these are all lymphoid cells, lymphocytes. You have seen a lymphocyte under microscope in peripheral blood. These are also lymphocytes. So, this proliferation of lymphocytes in a lymph node, no follicular structure. Lymph node ki thakbe follicular structure in follicles thakbe like this. So, what I have drawn on the left is the follicles, like follicles means in medical science it means flower, flower like. So, when there are follicles in lymph node, it is normal. When there is no follicles, like this, is there any typical arrangement? No. Cells are almost uniform, dispersed. So, this is lymphoma. If it is in follicular structure, this is normal lymph node. So, this is the basic difference for you and also for me. We diagnose lymphoma under microscope, but hello. Please don't do. Just if you want to write also, there is no problem. Have something in your brain that I have attended this class on this auspicious day. Remember one line or two lines. Okay. Next. Ek minute. So, before that, last porta. ওখান থেকে হবে? These are lymphoid cells. These are Reed-Sternberg cell. Write it down. Reed-Sternberg cell, short note. Give a star mark. Reed-Sternberg cell, short note. So if these cells are big cells, looking at you just like an owl, these cells, by these cells we are able to diagnose Hodgkin's lymphoma. And for you, this is important, Reed-Sternberg cell. The full name is Dorothy Reed-Sternberg cell. So we diagnose lymphoma, especially Hodgkin's lymphoma, by this. In medicine book, it's written it's not lymphoma. Some book says it is Hodgkin's disease. That is also correct. These are undergraduate, postgraduate mixed PPTs. So for you, this is very important. Write it down. Write it on your notebook. This is a lymphoma arises from crippled B cell. Write it down. And this is also important, characterized by large neoplastic, mononuclear or multinucleated cells. Background is lymphocyte, plasma cell, eosinophil, neutrophils. So basically, crippled B lymphocyte, Hodgkin lymphoma arises, and there are presence of giant cells, which we call Reed-Sternberg cell. Remember that if you examine any patient, if you see many cervical lymph nodes both sides, farm to heart, and patient is suppose very young, 30 years, 32 years, 35 years, like this, one of your diagnosis is Hodgkin's lymphoma, though it has got a bimodal presentation. Many diseases have got bimodal presentation. One at the young age, one at the elderly age. So this is basically it arises, starts in cervical lymph node, it goes on spreading, cervical, axillary, etc., etc., and it's a young patients, individuals are mostly involved. Maybe it's at the elderly patient also, it can arise. Now there are two divisions. This is important for your theory writing. Classical Hodgkin lymphoma, 90%. Nodular lymphocyte predominant Hodgkin's lymphoma, this is 10%. So learn by heart the classical one, it's important for you. Classical Hodgkin's lymphoma. Write down a question. First question was Reed-Sternberg cell for Viva and short note. Write down another question. Classify Hodgkin's lymphoma. This is a short, long question, short type question. Hodgkin's lymphoma. You have to write this, the classical Hodgkin lymphoma, its cytological features. It has got 4 division, nodular sclerosis, lymphocyte rich, mixed cellularity, lymphocyte depleted. So this 4 sub-classification under Hodgkin's lymphoma is your one of the long questions, medium length questions. I have talked about localization. See cervical lymph node 75%. So when you are examining a patient and if you see cervical lymph nodes enlarged, be very careful. Am I dealing with Hodgkin's lymphoma? 75%. And what is that? Mediastinal lymph node. This is also, if you suppose you are reading one CT report, CT chest, if you see mediastinal lymph nodes, in the chest lymph nodes. Then also think of a specific variety of Hodgkin's lymphoma, nodular sclerosis, Hodgkin's lymphoma. So this is also very important. Apart from the lymph node enlargement, and liver spleen enlargement, what a patient will complain to you, যে আমার স্যার ভালো লাগছে না, I'm not feeling well, I'm weak, there is evening fever, with chill, etc., etc. These are, in medical jargon, we call it B symptoms. B symptoms. So, what is its importance? There is a clinical staging of lymphoma. In everything in medical science, in medical oncology or medical cancer, sarcoma, there is a clinical staging. Suppose stage 1, stage 2, stage 3, stage 4, stage 1 is better, stage 4 is worse. So, if B symptoms are present, staging will be worse, not better. If B symptoms are absent, staging will be better. These are called B symptoms. Remember the term, B symptoms. Next, lymph node should be like within 1 centimeter. 1 centimeter, maybe 0.7, 0.6 centimeter. It is very big. Very big lymph nodes. So, if you cut this, it gives the appearance of fish flesh appearance, a fleshy look. So, this look will arouse your suspicion of lymphoma. So, enlarged lymph node, encapsulated fish flesh tumor, fish flesh appearance. And in nodular sclerosis, there is nodularity, fibrotic blend. So, this is microscopy. Very big lymph node, fish flesh appearance. So, classical Hodgkin's lymphoma is diagnosed by what I have said, the big cells is called Reed-Sternberg cell. If the cells are, this is multilobulated cell, the nucleus is multilobulated. If the mononuclear variant is there, it's called Hodgkin cell. Lacunar cell is important for you. It's a variety of Reed-Sternberg cell. It is important for you in MCQs and for diagnosing nodular sclerosis variety. So, classical, as I have told you, classical Hodgkin's lymphoma has got 4 divisions. How it looks like, Reed-Sternberg cell, it's a very big cell, nucleus is binucleated, nucleoli is eosinophilic nucleoli, these are binucleated, and this cytoplasm is amphiphilic. And there is around the nucleolus, there is a vacuolation. These are not 2 nuclei, these are 2 lobes of a single nucleus. Abundant basophilic cytoplasm, 2 nuclear lobe, prominent eosinophilic nucleolus, perinuclear halo. Acha, write this 5 points, write it down. We asked this in the examination. Write these 5 points. Examination, and most of the students, they can't answer. So, write this 5 point for Reed-Sternberg cell for your note. Write it down. We call it RS cell. First point is large cell. Second point is abundant basophilic cytoplasm. Third point is 2 nuclear lobe. Fourth point is prominent eosinophilic nucleolus. Then perinuclear halo. Write this 5 point. This is important for your writing short notes and for your Viva examination. I am moving on to the next slides. We give rise to a connotation owl's eye nucleus. Compare, these are owl's eye. Just like this. So, remember by this jargon, owl's eye appearance. So, all these points will make your short note of Reed-Sternberg cell. Important for short note. This is a fine needle aspiration cytology, not biopsy. In fine needle aspiration cytology, we take out with a syringe some cells, examine it, and we are able to give report within half an hour, and this is the appearance. These are the large cells. It is sometimes very easy for us and sometimes very difficult if these Reed-Sternberg cells are less in number. Jodi Reed-Sternberg cell কম থাকে, it is very difficult for us at this old age to diagnose Hodgkin's lymphoma. তাহলে these cells are important. I am showing you another type of Reed-Sternberg cell like this. It's called lacunar type of Reed-Sternberg cell. এটা তোর একটা give a star mark for your MCQ in future studies. Lacunar type of Reed-Sternberg cell is found in nodular sclerosis type of Hodgkin's disease. এটা লিখে নে. Write it down. This is important for your MD entrance examination. Lacunar type of Reed-Sternberg cell is important for nodular sclerosis type of Hodgkin. Seen in nodular sclerosis type of Hodgkin's lymphoma, there is as if it looks like an island. One island in a sea is called lacunar cells. Mummified cells. This is another type of RS cell. Just remember the name. Mummified cells. Cells are irregular, shrunken, mummified. Another type, you will find it in many MCQs. This is most important for you. Write the first 3 lines. If you do the antigenic study, that means CD study, that means immunophenotyping. This is very important. CD30 must be positive in Reed-Sternberg cell to call it Hodgkin's lymphoma. CD30 is the hallmark. And CD20 is weak. Though you know the CD20 is antigenic marker of B cells. As these cells are crippled, this does not show CD20 antigenicity. So CD20 negative, CD30, CD15 positive is Hodgkin's lymphoma. What is Hodgkin? CD20 negative, absent B cell marker and CD30 positive. Na hole amra we won't call it Hodgkin's lymphoma. So write this line. This is very important. So this is nothing but what we have all discussed. If you see cervical lymph node or mediastinal lymph nodes on CT thorax, and if they are CD30 positive and CD20 negative, diagnose it as Hodgkin's lymphoma. Because just by seeing lymphoma, you cannot stamp it is lymphoma. তুমি ডায়াগনোজ না করলে অনকোলজিস্ট ওন্ট গিভ কেমোথেরাপি। তোমাকে দেখাতেই হবে দ্যাট দিস ইজ the notes are important. CD30 positivity is important, CD20 negativity is important. And if you do Epstein-Barr Virus study, it will show positivity in 40% of the cases, not all cases. Remember this. So this is one of the disease caused by Epstein-Barr virus. The same thing, we are discussing immunophenotyping or antigenic study. This look like this, CD30 positive. This study gives rise this brown color. If this brown color is present, it is positive. CD30 positive. There is another, it is not for you, for postgraduate students. there are different categories of Hodgkin's lymphoma. Which category is mostly associated with virus? This is the chart. So what does it show? The mixed cellularity variety of Hodgkin's disease is mostly associated with viral infection. Other are less. This is mostly associated. Nodular sclerosis. Nodular means like this. Nodule, nodule, nodule. This is one subtype of Hodgkin's lymphoma. Very important for Viva and your MCQs. These are nodules, these are sclerosis. Sclerosis is nothing but fibrosis. So fibrous bands divide the lymph node into small nodules. So this is nodular sclerosis, where the lacunar type of giant cell is found. Lymphocyte-rich Hodgkin's lymphoma, where the pattern is full of lymphocytes. Mixed cellularity, mixture of all cells. In the background there are mixture of all these cells, eosinophil, monocyte, neutrophils, etc., etc. Mixed cellularity. Lymphocyte depleted, no lymphocyte at all. Ekdom dekhe phaka phaka lagje, no lymphocytes, and it is full of Reed-Sternberg cell. So these are four types: mixed cellularity, nodular sclerosis, lymphocyte predominant, rich, and lymphocyte depleted. This is, just remember the name, this is another type of Hodgkin's lymphoma which is not classical. Non-classical Hodgkin's lymphoma. This is another type. It is called nodular lymphocyte predominant Hodgkin's lymphoma. Remember the name, this is another type. So there are two types, classical, non-classical. This is non-classical. Nodular lymphocyte predominant Hodgkin lymphoma, we call the short name NLPHL. We call it NLPHL. What is that? What is your diagnosis? Hodgkin's lymphoma, NLPHL, non-classical type. I am skipping this slide. These are the things. Here CD20 is positive. Like classical, CD20 was negative, here CD20 is positive. There are some well-defined diagnostic criteria. I am skipping this. Remember this picture. This is every hematological malignancy, every cancer there is a staging. How can you say it is good or bad by examining a patient? So these are stage 1. Only one group of lymph node. These are stage 2, cervical lymph node, and the disease has spread to axillary lymph node, stage 2. But both are at one side of the diaphragm. So stage 1, stage 2 lymphoma, they are at the one side of the diaphragm. If it goes to another side of the diaphragm, but there are two groups. It's called stage 3. If it spreads, it's called stage 4. So in Ann Arbor and place in America, where the staging is done many years before, it is still valid. Ekhono eta we recognize it, staging. তাহলে আমরা যে কোনো hematological case, any leukemia, any lymphoma, any cancer, we have to stage it. নাহলে আমরা বলতে পারবো না যে stage 1 is good, stage 4 is bad, unless we do the clinical staging. Pathogenesis of Hodgkin's lymphoma, this thing I have already told to you in a lucid manner, in a simplified manner. This is a complex one. This is for postgraduate student. If you are interested in postgraduate studies, this thing will be very, very important. But I am skipping this for the moment. You can have it in a good book. Pathogenesis of Hodgkin's lymphoma, survival proliferation of the Hodgkin cell. Prognosis amongst all lymphomas, if we consider both Hodgkin's and non-Hodgkin group of lymphoma, Hodgkin is curable. There are chemotherapy, there are 4-drug regime. Probably the pharmacology professor will teach you that. ABVD, at least remember ABVD combination. 6 cycle if you give, that will almost cure Hodgkin's lymphoma. It is a disease, it is a lymphoma group of disease which is curable, remember. Amra 4 drug, if we give properly and if the patient's general health is good, patient will be cured. Achha, this is difference between Hodgkin's and non-Hodgkin's lymphoma. Our next class will be on non-Hodgkin's lymphoma. After that, you will be able to understand this. This is very important. You can have somebody is clicking. You can click and take a photograph. What is the difference? It's in every book. So, in a nutshell, just I am telling, just listen 5-6 sentences. Malignancy of lymph node or lymphoid tissue is called lymphoma. There are so many causes of benign enlargement of lymph node. When the lymph nodes are very hard and very increased in number, we call it lymphoma. There are 2 categories, Hodgkin lymphoma, non-Hodgkin lymphoma. This class we have dealt with Hodgkin's lymphoma. It arises from crippled B lymphocyte. That means B lymphocyte is unable to show antigenicity. Remember this point. In some cases of Hodgkin lymphoma, there is participation of Epstein-Barr virus. Not all cases. In lymphoma, the ordinary architecture of a lymph node which we see through microscope is lost. No follicular arrangement. Cells are uniformly spread. This is microscopy for you, for me. This is Hodgkin's lymphoma. Next, Hodgkin lymphoma is diagnosed by Reed-Sternberg cell. Remember this. Reed-Sternberg cell is important for your examination. Don't forget to read Reed-Sternberg cell. If we classify Hodgkin's lymphoma, there are 2 types, classical, non-classical. Classical is most important, most common. In classical, there are 4 sub-varieties. Nodular sclerosis is important for you as it is very common, mostly given in examination, MCQ. How do you diagnose Hodgkin cell or Reed-Sternberg cell? CD20 negative, CD30 positive. Clinically, you can stage Hodgkin lymphoma. It is called Ann Arbor Staging, a place in USA. Hodgkin lymphoma is curable by chemotherapy, ABVD regime 6 cycle. So it is one of the lymphoma, malignancy of the lymph node, which have got better prognosis, curable. Give the assurance to the patient. This is all about Hodgkin's lymphoma. Thank you.